Hey, well, today I want to talk about glutamate. And most of you know it as monosodium glutamate, but we just want to go over, I want to do a little quick education on that because I had a patient come in today and she was having headaches, brain fog. She said her brain wasn't feeling right. And she's on several antidepressant medications and it's not working. And sometimes it could be glutamate. And anyway, some of the symptoms for that of high glutamate levels are muscle tension, pain amplification, anxiety, restlessness, trouble concentrating and focusing like ADD symptoms, headaches, insomnia, fatigue, and increased pain sensitivity. So you're going to see that when we look at this, some of the foods that are in that glutamate is in, monosodium glutamate, are these right here. It's in your processed foods. So you're looking at like chips, crackers, packaged snacks, processed meats such as hot dogs, sausages, or lunch meat. So you got to be careful there. A lot of your canned soups have it. Instant noodles, frozen meals, salad dressing, and condiments. And then, you're even going to have it in seasoning blends. And so, what it's famous for is really the Chinese buffet with soy sauce. So, those people will go, they'll eat the Chinese buffet and they'll have soy sauce, they'll have the lo mein noodles and everything, and they'll get like this glutamate headache, they'll get excited, they'll get irritable, they'll probably have a rough time sleeping that night. They just get tense. They don't feel good. It's probably not going to be a good night if you have to concentrate. So anyway, one of the tests we run on them, we run this genetics test on them. And as you can see here on this genetics test, what we're looking for is they don't have, so this is glutamate. You have to have glutamate. That excites you, okay? But it also has to go to GABA. And a lot of people probably know about GABA because that calms you down. GABA calms you down. Glutamate excites you, GABA calms you down. And you need them both. However, when you get too much glutamate and you can't get it to GABA because you lack these enzymes here, because this is heterozygous. So if this is yellow or red, it could be a problem. What are these people going to have? They're going to have a hard time calming down. They're going to have anxiety. They're going to have sleep issues. And it's all because MSG, monosodium glutamate, they'll call it, or they'll call it glutamic acid, they'll call it glutamine. But at the end of the day, they cannot convert glutamate to GABA, which calms them down. So there are things out there you can give them. One of the things we give them is we give them this here. It's called Neurocalm. And what Neurocalm does, Neurocalm has ingredients in it, but here's what it has. It has magnesium, zinc, L-glycine, L-theanine, and kava kava. But what that does, it helps this conversion here. And this conversion here is the glutamic acid decarboxylase, this enzyme. They lack the enzyme here to convert this. And when they lack the enzyme to convert it, they just can't calm down. And sometimes this will lead to addictive behaviors. So they'll use alcohol or drugs to escape that. And it's typically, when they get on like SSRIs or anxiety or depression medication or ADD medication, if it doesn't work, this could be a reason why it doesn't work. So anyway, we offer health assessments, go over this. I can explain it. We can also run a urine analysis test where we look at that. We look at glutamate and GABA, and then this is what it looks like on a urine test. It tells us if you have, you should be right in here. If it's too high glutamate, that means you're going to be excited. And then we look at GABA down here. If it's too low, that means you're not going to be able to calm yourself down. So you want those in good levels. So we can look at the urine, and we can also do genetic tests to see if that's something that we could help you out with. But anyway, I thought I would just bring this information to you and just share it because I know a lot of people are suffering with it. The lady that I saw the other day, she'd been struggling with it for years. And one of the key symptoms is they will say, they just can't focus. Their brain isn't working. They just don't feel like themselves. Okay. So like I said, if you've tried medication, ADD medication, some of the antidepressant medication or anxiety medication, and you're not getting the results, it could be something like this. And most doctors are not going to look at this. So when we're doing functional medicine, we're trying to find the root cause. We're not just trying to throw a pill at it. We're trying to find the root cause so that we can definitely pinpoint it and help that person out. Okay. Anyway, I hope this information was helpful, and we'll keep bringing it to you in the future. Okay. Thanks, guys.